Hey guys, my name is Katherine Young. I decided to do my micro lecture on preventative service coverage, and my article looked at pre-exposure prophylaxis for the prevention of HIV infection in evidence report and systematic review for the U.S. Preventative Service Task Force. So basically, this study looked at pre-exposure prophylaxis, so treatment for HIV infection to prevent it, and whether or not these studies prove that the United States should update their recommendations or not. So here's my outline slide. We're going to look at what PrEP is, the main purpose of the article. We're going to look at the methods used by the authors and the results that they found, what those results mean, and lastly, how the study relates to us. So what is PrEP? Pre-exposure prophylaxis therapy, or PrEP, involves using antiretroviral therapy, so medicines that work against retroviruses such as HIV, on a regular basis or after possible HIV exposure. And the hope is that these medications would decrease the risk of acquiring HIV. So the two medications used were a conjunction of two medicines. One is tenofovir disoproxil fumarate with emtricitabine, and then the other medication would just be the tenofovir disoproxil fumarate by itself. The main purpose of the study was to look at the benefits and harms of PrEP and whether or not it was effective at preventing HIV infection. This study looked at 14 different random controlled trials, and it looked at the effects of PrEP therapy, so whether or not the subjects ended up acquiring HIV, whether there were harms involved, whether there were mortalities of subjects. It also looked at other clinical outcomes such as side effects and adherence to therapy. And then 7 of the studies also looked at how effective the instruments were that were used to predict HIV infection. So there were 2 methods used. Really, there was one, but prospective cohort is a part of the random control trial. So the random control trials that were used, there were 14 of them, and these 14 put together had 18,837 subjects. So it was this study includes a huge amount of people, which is really good whenever you're looking at whether or not a medicine is effective, because it shows if it's effective for this many people, surely it will be effective for the general public. Also, it was a prospective cohort study. So the subjects either got treatment or they got placebo. And then there was follow-up done 4 months to 4 years afterwards to see who acquired HIV and who did not. They looked at relative risk to see whether the treatment was effective or not. So with relative risk, if the relative risk is 1, that means there's no effect at all. So the medication is basically just a sugar pill, or the effectiveness of a sugar pill. If the relative risk is less than 1, that means that the treatment is effective, and the further away from 1 it gets, the more effective it is. Lastly, if the relative risk is greater than 1, that means that our treatment is actually causing the patients or the subjects to be more likely to be infected with HIV, which is definitely not what you want to see. So the findings of the study were that PrEP therapy was associated with decreased risk of HIV infection versus the placebo. The relative risk was 0.46, which means that since the relative risk is less than 1, the therapy is effective. The absolute risk reduction is negative 2%. So those people who got therapy were 2 times more likely to not be infected than those who received the placebo or no treatment. And then it also showed that those subjects that took the treatment at least 70% of the time had a relative risk of 0.27 compared to just 0.46 for anybody who received the treatment. So it was more effective if you took it at least 70% of the time. There were some limitations to the studies, so there were some side effects. One of the side effects was renal, so kidney effects, and then the other side effect was GI issues. It said that the side effects that were involved were generally mild and reversible, so once the people stopped getting the therapy, those side effects went away. There was also some inaccuracy of instrument predictions, so that would need to be reviewed further. And then lastly, adherence is always an issue, because if you're taking this medication on a daily basis and you don't have HIV, and then you start having symptoms or side effects that were caused by the medications, it makes you want to stop. So what do these results mean? It means that PrEP therapy is efficacious or could be effective in the general public when it's taken as directed. With a study that is as big as this one, with 18,837 subjects, and a multi-site study, this one looked at studies that were in US, Europe, Canada, Africa, and Thailand, so it's worldwide studied. It should be generalizable and it should be replicable. So they should be able to release this to the general public, and it should be effective. Lastly, we're going to look at how it relates to us. In this class, we've been reading and learning about the business side of healthcare. So how would it affect us if we were able to prevent HIV infection in the United States or in anywhere that we end up worldwide? It could not only prevent sickness in the person that receives the treatment, but it could also prevent treatment in those that they would communicate the disease with. So those that they would share HIV with, it would prevent that. So it would prevent HIV infection spread. It would also prevent early deaths, which if you're going into healthcare, you will see early deaths. So it could prevent these early deaths from occurring. And lastly, it would save healthcare dollars and resources, which we will all see as we continue to grow in our careers. This is the reference to the article if you're interested in looking at it further. It's a really, really long article, but it is really good. Thank you so much for listening, and I hope you have a great day.